Hello, and welcome to today's Pedestrian and Bicycle Information Center Livable Communities webinar series. Today's webinar is entitled Community Approaches to Pedestrian Safety Education. We are joined by co-presenters from each side of the country. Dr. Jillian Hotz and Christine Stinson will talk to us about the WalkSafe program in Miami-Dade County in Florida, while Linda Crable-Byrne and David Parisi will discuss the implementation of the Street Smarts program in San Jose and Marin County, California. My name is Jeremy Pinkham, and I am the Communication Coordinator for PBIC and the UNC Highway Safety Research Center. I'll be facilitating today's webinar. Attendees, if you can hear me, click the hand in the box in the upper right-hand corner of your screen and raise your hand so that we can be sure our audience can hear us. See, we're getting a lot of hands raised, so that's good. People can hear us. Before we get started with today's webinar, I want to go over a few administrative details and the functionality of the webinar software. Let's take a look at this slide that shows the webinar interface. As an attendee, you have a control box in the upper right of your screen that collapses and expands by clicking this arrow button here. If for some reason your computer or web browser freezes during the webinar, please reload the website and log back into the program. If you experience audio difficulties during the webinar, please be sure you have selected which audio mode you are using and follow the instructions provided for that mode. Please note that attendees will not be able to speak during the webinar. We do expect a large number of attendees on this call, so by muting your audio, it helps us to cut down on confusion and background noise. Though you won't be able to speak, you will have the ability to ask questions by entering them in your question box here. If you have a problem during the webinar, you may enter it here, and I'll try to respond to you if I'm able. Questions pertaining to the presentation itself may be asked at any time in the question box, but will not be addressed until the end of the program when we have built in about 20 minutes for a discussion period. Please feel free to ask those questions as we go along, and we'll get to them after the presentation. Also, so that you're not alarmed when you exit the webinar, I want to let you know that a very brief survey will open up after you leave. We would very much appreciate your feedback on our performance. Now, before we get started with today's program, I want to give everyone a little information about what this webinar is about. The goal of the Livable Communities webinar series is to better enable our audience to improve the quality of life in their communities by promoting safe walking and bicycling as a viable means of transportation and physical activity. The webinar series was developed by the Pedestrian and Bicycle Information Center, the national clearinghouse of pedestrian and bicycle-related safety information and resources. We offer information and technical assistance to diverse audiences about health and safety, engineering, advocacy, education, enforcement, access, and mobility as it relates to pedestrians and bicyclists. PBIC and today's webinar are both made possible with funding from the U.S. Department of Transportation's Federal Highway Administration. The next Livable Communities webinar will be held on Thursday, April 15th, 2010, from 2 p.m. to 3:30 p.m. Eastern Time. The topic is the impact of the new MUTCD on pedestrians and bicyclists, and will be presented by Bruce Friedman and Scott Wainwright, who are both on the MUTCD team of the Federal Highway Administration. The registration link is now live and can be found at walkinginfo.org/webinars. There, you will also be able to access archived recordings, transcripts, and additional resources from today's and past programs. It'll take about a week to get today's webinar posted. In addition to these webinars, PBIC offers 4 different in-person training courses to provide technical assistance to professionals and community members in developing pedestrian safety action plans and improving conditions for walking. These courses can be found at walkinginfo.org/training. And now, before I introduce our first speakers for the feature presentation, I want to take a quick poll from the audience here. And you should have a poll up. Please let us know how many participants are viewing the webinar at your site. And now, while you're completing the poll, I'll tell you a little bit about our first speakers. Dr. Jillian Hotz is at the University of Miami Miller School of Medicine, where she is co-director of the Pediatric Brain and SCI program, director of Neurotrauma Outcome Research, Concussion, and the WalkSafe and BikeSafe programs, and an associate research professor in the Department of Neurosurgery and the Miami Project to Cure Paralysis. Dr. Hotz is the principal investigator on many national, state, and local grants for injury prevention, research projects, and clinical trials for children with traumatic brain injury. She has presented at many conferences on the local, national, and international levels, as well as published extensively in journals and books. Christine Stinson is currently a candidate for the master's degree in public health at the University of Miami, where she is focusing on health disparities and epidemiology. Christine currently manages the WalkSafe program's 3-year transportation enhancement project. The WalkSafe program was developed in 2001 at the University of Miami Miller School of Medicine and the Ryder Trauma Center at Jackson Memorial Medical Center. Its goal is to improve pedestrian safety, increase physical activity, and enhance walkability surrounding elementary schools throughout Miami-Dade County. Since the inception of the WalkSafe program, pediatric pedestrian hit-by-car rates have declined by more than 40%, and WalkSafe has been identified as a significant contributor to the reduction of these rates in Miami-Dade. The program has been piloted in 9 other high-risk counties throughout the state of Florida. Okay, now we'll just conclude our attendance poll. We'll close the poll here, and we'll take a quick look at the results. Glad most people are watching on their own today, but we do have a few that are watching together and hopefully sharing some good information. So now, without further ado, I'm going to pass the control of the screen over to our speakers in Miami. And I'd like to welcome and thank Dr. Hotz and Ms. Stinson for their presentation today. And please take it from here.
Okay, great. Thank you so much, and I'd like to thank PBIC for inviting us to be part of this webinar today. I'd like to just start off by saying that we're going to try and cover most of the scope of our program, starting with just a little bit of background and some information, how we built the program, how we used the 5E model, and then we'll talk about some strategies for moving forward and how we're going to sustain the program. We have really started out in about 2000-2001 with developing our program here at the University of Miami, Jackson Memorial, and our Ryder Trauma Center, and it's really been a team approach. We've had a lot of different funding sources, as you can see, from the Miami Project, the Children's Trust, the Department of Health, Safe Routes to School, Nike, and the University of Miami, and also the Florida Emergency and Medical Services have been very helpful in letting us continue our work here at the university. To look at Miami-Dade County and sort of see what we're talking about here, it's really a community that is very multicultural, multi-ethnic. We have a lot of different types of communities here in our county. We have 35 municipalities, over, you can see, 2,400,000 total population. And our target group that we target here in Miami-Dade is children in elementary school, K through 5th, and you'll be hearing a little bit more about our program. This is about 262 elementary schools. We're the 4th largest public school system in the country. And basically 68% of our people who live here speak another language other than English, primarily Spanish or Creole at home. Okay. I wanted to talk a little bit about the problem so you can get an idea of what our numbers look like every year. As far as children that get hit by cars, we covered 2 major level 1 trauma centers in Miami-Dade County, Miami Children's and here at Jackson. And you can see we've been trending these numbers since 2002, and these numbers are really coming down as far as the prospective data of children 0 to 14 that come in through these centers, as well as looking at the number of kids that come into these centers prospectively. We also have very good sources of data from our crash data, Florida Department Highway Motor Safety, which we trend also every year. And you can see that our targeted age group of 10 to 14 had really started out in 5 to 9 in higher numbers in 2001, 2002. And we've also been able to show a decrease over the last few years in these numbers as well. Our mission has always really started out as trying to improve pedestrian safety, so decreasing the number of injuries and fatalities of these children. Secondary, increasing physical activity levels. We know that the hot topic over the last few years has decreased is obesity in this country. So trying to encourage kids to walk to school and walk home daily, and then also enhancing walkability in these communities. It's a 5E model. In 2002, 2003, we realized when we got together with a task force here at our trauma center that we needed partners, and we had to work together to really resolve this problem in Dade County. So you can see we're going to be talking about the educational component mainly today, but we work very closely with enforcement, multiple police departments, school board police, engineering, Department of Public Works, the traffic engineers. We have multiple outreach events throughout the year, and then we've been evaluating our program since its inception. It's been a long road, and it's really interesting to take a look now, 10 years later, of where we've come from doing one small district, looking at 2 schools, comparing them to 2 schools that didn't get the program, then doing a 16-school district and looking at one of our highest risk districts, Liberty City, and then from there trying to get more high-risk districts in the county involved in implementing the program, and trying to now make this program throughout the state of Florida, working in other high-risk districts. The way that we really looked at this, another source that we use is the GIS mapping, where we were really able to target where most of these injuries were happening throughout the county, and we started with the highest risk area, which I was talking about, which you can see is the blue, the Liberty City area, and then we really hit and prioritized our areas as the numbers show up in some of these different communities. The educational component of our program has really been the main component which we've evaluated and we've sort of been developing over the years. And I'm going to now turn the program over to Christine Stinson, and she's going to go through the rest of the presentation to discuss the details of the program.
Okay, thank you, Dr. Haas. And just to give a general overview of what our educational component is comprised of and what it's all about. It's a 3-day elementary school-based educational curriculum, and it's designed to be implemented 30 minutes per day on that 3-day period. It's designed to equip teachers in elementary schools to provide pedestrian safety and health education to their kindergarten through 5th grade students. It's taught annually, normally during the first full week in October to coincide with International Walk to School Day, which is usually held on a Wednesday, and students complete the curriculum and then they use their WalkSafe skills during the iWalk event, which is kind of the culmination and the everything coming to a head with the program. And okay, so this is just to give a general idea of the layout of how our curriculum is designed. Day 1 is intended to be a video. Students receive a pedestrian safety and health video, and then they engage in a teacher-led classroom discussion. And then Day 2 is designed for them to take those skills that they learned in Day 1 and to really put them into action and use kinesthetic and use their kind of involve more senses into the process. And then Day 3 is to really for them to be able to show what they learned and to teach someone else about pedestrian safety. If they can teach someone else, we know that they've mastered those skills through a poster contest or a creative activity, because some schools, they don't just subscribe to the contest idea and they like for their children just to enjoy a creative activity. Okay, so the 3-day curriculum was designed with a lot of different characteristics in mind in order to kind of maximize sustainability and maximize our reach. We really wanted to take all of these things into consideration when creating and when revising our curriculum. And so the first thing is that it's easy to implement. It's a 3-day, 30 minutes per day program, so the children are receiving an hour and a half of instruction. So it's easy to implement in the schools, but it's also, as you go further down the list, it's evidence-based. So we tried to kind of find a happy medium between making this easy for schools to engage in, but at the same time making sure it's effective. And so it's also multimodal. It allows students to learn pedestrian safety and health skills using different modes of learning. They learn audio and visual from the video and the discussion. They learn kinesthetically through the outside simulation and poster contest. So we know that students learn in different ways, and so to be able to maximize their knowledge gains, we really tried to incorporate different modes of learning. And so we also ensured that they're developmentally appropriate. And so we have 3 different curriculums, one for kindergarten and first graders, one for second and third, and one for fourth and fifth. And that's to ensure that they're learning these skills and they're learning this knowledge at a level that's appropriate for their developmental and their stages in their grade level. And so we also, over the past couple of years, have really tried to make our curriculum inclusive. And so this past year we've included strategies that teachers can use to include students with cognitive and linguistic impairments or disabilities. And in the upcoming years, we're actually going to be designing a curriculum for students specifically with cognitive and orthopedic impairments. And so, as I mentioned before, we've evaluated and reevaluated to ensure that with all these revisions and different incorporations that we're continuing to use an evidence-based curriculum, we're continuing to make sure that our curriculum is effective in doing what we're aiming to. And so we've made it teacher-friendly, as I mentioned. We've included teacher tools and supplemental materials to allow the teachers to incorporate these lessons not only just during WalkSafe Week, but to allow them to incorporate it to their regular reading, mathematics, and data lessons. And so, the actual curriculum is only a couple pages, but we've included a ton of different supplemental materials to really make sure that they can get this year-round. And lastly, the curriculums are easily accessible. We've kind of tried to transition to a fully web-based resource for schools, and all of our curriculums are free and accessible on our website, which is www.walksafe.us. Okay, so this just shows how we disseminate the curriculum. It's our Train the Trainer model, where the WalkSafe staff holds regional trainings, both in person and through conference call if necessary. And at those regional trainings, we train our elementary school representatives. And typically those include an assistant principal, a PE teacher, and an art teacher. And the reason we ask those 3 entities to attend is because they have the largest stake in the program. They're the ones that are they're really making sure it gets done. And so those representatives, they go back to their schools and they train all of the different homeroom teachers on how to implement the program and how to access our materials. And then so those teachers are really the ones that get the program out there and make sure that each of their students receive these skills. Okay, and so a little more in-depth view of each day of the curriculum. Our first day includes a video and teacher-led discussion. The video demonstrates important pedestrian road safety concepts through audiovisual media, as we said. And the teacher-led discussion just reinforces those video lessons and concepts. It includes some trivia that the students can answer and kind of an open-ended discussion on what students feel about or how they interpret the safety and health lessons. And they also discuss the benefits of daily walking. Okay, and then day 2, which consists of our outside simulation activity, it first reviews day 1 concepts to ensure that the students really retained what was taught in the video and discussion. And then they go out on normally a PE court or a grassy area, depending on what the school has access to. They engage in actual street crossing events on a simulated road, which can be made with cones or rope or whatever materials are available to the school. But it really gives students kind of a real-world perception of how to put these skills into action. And so at the end of the activity, which the activities are, again, developmentally appropriate, so each of the curriculums has a different kind of simulation activity, but at the end of it, all the students are able to demonstrate safe crossing behaviors. And then finally, day 3, which consists of our poster contest or creative activity. As I said, the students demonstrate the knowledge they gained from the previous 2 days. And then this year was the first year that we actually kind of really built some awareness and some encouragement around our poster contest. And we did a statewide poster contest that we're really proud of that we'll get to on the next slide. But Those posters are scored on message quality, their creativity, and the artistic merit of the poster. And then those winning posters from each school are entered into our statewide WalkSafe poster contest. And so this just gives an overview of this past year. In the middle, you'll see our 2009 winner, Tangi Perry. She's a 4th grader from Lee County. And she obviously was the county winner for Lee County, and then she went on and was judged against another 10 posters from 10 other counties in Florida. And she ended up coming away with it. Her poster is the one on the top left, the Walk with Your Eyes message. And then the other 3 posters are just a couple other of our county winners. And so we found that this was really an effective way to make sure that, number one, that these schools were completing all 3 days of the curriculum. We found in the past that without some kind of prizes being awarded and emphasis on day 3, people were skipping out on it. They thought that it was kind of just a supplemental activity that really didn't contribute to any knowledge gains. But actually, in fact, we've really tried to stress this over the past year or so. Our curriculums are only they're only evaluated on the entirety of the 3-day curriculum. So we really emphasize that we can't make claims that these students are gaining knowledge if they're only participating in day 1 or day 1 and 2 of the curriculum. So we found that this was a really effective way to ensure that the students were receiving all 3 days of the curriculum. And so we leveraged some resources. We got some prizes donated from Nike, and we got, for our statewide winner, a computer donated through Tiger Direct. And so, you know, although we aren't funded to do these things, we've really tried to leverage some resources in the community to really build some excitement around this poster contest. And so this just gives you an idea of our reach in Miami-Dade County. And in the next couple of slides, I'll go over how we've really been able to maximize it. But as you can see, since 2007, we've pretty much been able to double our reach. We've been able to more than double the number of schools that have participated and more than double the number of teachers trained since 2007. And we've also been able to, probably most importantly, double the number of students that we've educated. And so we've gone from, since 2007, we've gone from about 70,000 kids reached to about 144,000. And that's pretty significant considering that the 2009 numbers represent over 90% of our children in public and charter elementary schools in Miami-Dade County. And so this kind of shows you some strategies we've utilized to maximize our reach in the county. And starting at the top, we've been able to advertise our trainings in-house and through partners. We have a quarterly newsletter that goes out, and many of the subscribers are teachers and school administrators. And so we advertise that in our newsletter and also through some of our partners throughout the county. We've been able to evaluate and update our materials using feedback from the teachers. And we've really found that if you listen to what the teachers say, they're much more likely and willing to participate and to go along with the curriculum. And we continue to offer technical assistance to all participating schools. We combine our grant resources to make sure that all schools in the county have access to all of our materials and to our staff if necessary. And we, probably most importantly, built relationships with school personnel. And so, you know, since being mandated since 2003, which I'll talk about in a little bit, we've really been able to build relationships with administrators and with PE teachers and art teachers, and those are more important than we could ever convey. And we also offer, as I mentioned before, on-site and remote trainings to accommodate all schools. So if school representatives can't attend our on-site trainings, we offer multiple conference call trainings and remote trainings to make sure that, you know, schools that are willing to participate have what they need and have what's necessary to get those lessons to their kids. And lastly, probably most importantly, from, you know, a top-down perspective, we've been able to obtain a school board mandate and support from the school board and our region superintendents to enforce that policy. And so that's probably, you know, one of the most pivotal achievements and relationships that we've been able to build in really being able to reach all schools and kind of make sure that these schools are doing it every year. Okay, so these are a couple of the barriers that we face in Miami-Dade County and during our dissemination statewide. And I've listed some of the strategies that we've used to overcome them. And the first is resistance from school personnel. And so, as we all know, teachers are overburdened, they're underpaid, they've got so much curricular content that's required and recommended. And so it's been a little bit difficult, especially in the beginning, to really kind of get their buy-in. And so, as I mentioned, that school board mandate and continual follow-up with each of these schools. Every year we follow up with them and ask whether or not they implemented and why they didn't implement it if applicable. And finally, evaluation and revision. So as I said, using a teacher survey, we make sure that we kind of minimize that resistance from school personnel from year to year by making it more teacher-friendly and reducing the burden on any one entity in the school. And also, we've had some difficulty replicating our success that we've had in Miami-Dade County in other counties in Florida. And so we've kind of developed a statewide dissemination model that these other counties can follow. And depending on the needs of that specific county, we've kind of tailored our intervention and tailored that dissemination model to fit the needs of that county. And finally, we've had some policy barriers that have limited progress toward our aims, and I'm sure many of you can relate to this. We've, in trying to encourage kids to walk to and from school, it's, a difficult task when, there's not crossing guards on the corner or there isn't a flashing light telling people to slow down. And so we want to make sure that, while we're encouraging physical activity and walking and all of these healthy behaviors, that the safety infrastructure is in place. And so we've kind of, over the past couple of years, really taken a seat at many of the policy-making tables in the county, and we've created some proposals for policy change, and we've broadened our scope to really place this at importance for our program. Again, we've also realized it's not enough just to educate the children. It's not enough to just get this curriculum out there and get these kids learning safety skills. It's also reaching their parents and reaching these policymakers, as I mentioned. And so we use a number of different strategies for each group, including community outreach education. We piggyback onto health and safety fairs throughout the county in attempting to reach these parents. We create targeted interventions at parents from different backgrounds and different cultures to make sure that they're getting these skills and they're gaining knowledge in a way that's appropriate for them. And then policymakers, we make sure we're at the table at many community meetings, including community traffic safety teams, the Metropolitan Planning Organization, our Injury Prevention Coalition here. And we also create individualized updates and presentations to these policymakers. So this past year we've met with almost every county commissioner and made sure that they're abreast of what's going on in regards to pedestrian safety and health in their district. And so it's a lot easier to get their buy-in and to make them aware of policy issues when they know what's going on in their kind of in their backyard. And so these are a couple of the evaluation tools that we've used to evaluate our educational component in our curriculum. And the first being our curriculum completion form. And that gives us information on the number of participating teachers, schools, and students each year, so that we're not guesstimating how many we're reaching. We're actually getting hard numbers. And the second is our teacher survey, as I mentioned before, and that asks a number of questions trying to gain teachers' suggestions and opinions of the curricular content so we can revise it and make it more teacher-friendly and get that buy-in from teachers each year. And so we've also done some educational testing, as I mentioned. It's evidence-based, and so we've tested the efficacy of the curriculum in actually increasing knowledge of pedestrian safety in each of those age groups, in the kindergarten through first, the second and third, and also the fourth and fifth graders. And we've also done a behavioral study that's testing the actual effectiveness of the curriculum in translating that knowledge to improved pedestrian safety and health behaviors. And so that data from the behavioral study is being analyzed now. Okay, and so as we mentioned before, it's not enough just to educate. We work with a number of partners, and we have a number of different components that we use to complement our educational efforts throughout the county, and some of those are listed here. As I mentioned, we organize and provide technical assistance to any school in the county that is interested in conducting an iWalk event at their school. We participate in multiple community outreach events throughout the county and throughout the year. We've recently started social networking sites, Facebook and Twitter, to make sure that people are aware, our followers are aware of what we're doing in the community on a real-time basis. And we also have our website, which has definitely assisted in disseminating that educational component and in our transition to a web-based resource for schools. And we, as I said, we're at the table at a number of community meetings. We've created a neighborhood pedestrian watch program, which I'll mention in a few slides. We present incident reports from the schools, and we kind of bring that full circle. If we hear of a pedestrian hit by a car, we get engineers back to the scene. We make sure there's no engineering modifications that can be made to make that area safer. And then lastly is our e-newsletter, the Walk Street Journal, which I mentioned before, which goes out quarterly to all of our subscribers. Okay, and so one of the most important things, I think, especially for this webinar in our community approach to pedestrian safety, is the fact that we've created an adaptive approach, and we've created an approach that works for Miami-Dade County, for our community, which is very diverse here. And so as you can see from the graph on this picture, or on this slide, our ethnic and racial composition is much different than that of the overall United States. And so we've kind of had to tailor our interventions and our materials to make sure that they're culturally sensitive, that they're multilingual, and that they're going to be able to educate people in a way that's appropriate for their group. And so you can see here that all of our materials are printed in English, Spanish, and Creole because of those are the three most widely spoken languages. And we try to make sure that we incorporate all ethnic and racial groups in our graphics and just make sure that they're culturally sensitive. And so also, as you can see here, much of our population is foreign-born, and fewer of our residents have graduated high school when compared with the U.S. population. So we've had to adapt our materials and interventions to meet these specific needs. And just as an example, we created a neighborhood pedestrian watch program, which was this year, which was based off of the traditional neighborhood speed watch program. And what we found when we went into this community, and it's actually the Homestead community in South Miami, we found that many of the parents didn't know basic pedestrian safety rules. And so for them to go out there and to kind of take an active role in pedestrian safety in their community, they needed to be educated. We couldn't just expect them to go out there and inform others of this if they didn't have a really good grasp on it themselves. And so attacking these cultural issues, these foreign-born issues, these educational issues has been a really important part of kind of attacking the education from all angles. Okay, and so lastly, kind of the stage we're at with our educational component is figuring out how to sustain this program and disseminate it, and while keeping it current and keeping it evidence-based. And so starting at the top, although we want to maintain a presence in Miami-Dade County and further disseminate it throughout the state and nation, we continue to focus our efforts in the areas that need it most, in the areas that are high risk for pedestrian injury and fatality, and also the areas that are high risk for obesity and other health issues. And so the green squares are kind of those things that we've deemed appropriate to and deemed necessary to be able to sustain the educational component here. And those gray squares kind of are how we've done it and how we're going about achieving things in the green. So we continue to demonstrate effectiveness through evaluation and revision of our curriculums. We continue to build community awareness. We are constantly gaining political support and other partners to support those awareness efforts. And we continue to replicate and generalize. So we make sure that our materials are free, accessible, and feasible. And we continue to, although we pilot in certain populations, we continue to make sure that they're appropriate for all groups. And we try to translate that research. We use a training model and policy development to make sure that those that increases in knowledge are translating to improved behaviors. We try to disseminate. We use adaptable models, as I mentioned before, through adapting our statewide model to fit different counties with different needs. And lastly, and one of the most probably important things here is that we continue to secure resources. So we're finding every day that our partnerships are absolutely invaluable in being able to do this. And so the more partners we gain, the more funding avenues that become available for us to be able to sustain. And so that's it. And I just want to remind everyone that all of our materials and a contact form in case there are any other questions are available on our website at www.walksafe.us.
Okay, great. Thank you very much, Christine, and thank you to Dr. Hotz as well for our first presentation today. It was great, and we already have a few great questions lined up for the end. I'm going to pass the screen over to the West Coast for the next presentation. Before we move into the next presentation, though, I just want to mention to our listeners that there's a new and expanding PBIC video library, and it actually includes one of the Willie Whistle educational videos produced by NHTSA that was mentioned in the mentioned earlier today. And you can look that up at walkinginfo.org/videos. And just want to introduce our next speakers before they get going. Linda Crable-Byrne currently serves as Traffic Safety Education Manager and Public Information Officer for the City of San Jose Department of Transportation, where she manages the nationally recognized Street Smarts Traffic Safety Education Program. Ms. Byrne is a past president of the California Association of Public Information Officials and founded the association's professional development program. In 2007, the association presented her with its Paul B. Clark Lifetime Achievement Award for exceptional leadership and excellence in public communications. The Street Smarts program, which she developed, has received top awards from AAA, the Institute of Transportation Engineers, the California Transportation Commission, and most recently the Alliance for Biking and Walking. San Jose was also presented with an America's Crown Communities Award in Public Safety for its Street Smarts program. And David Parisi is a registered civil and traffic engineer and a principal with Parisi Associates Transportation Consulting based in San Francisco. He has developed Safe Routes to Schools programs for several municipalities along the West Coast and assisted the PBIC in the development of the online Safe Routes Guide. Mr. Parisi has led national pedestrian safety training efforts throughout the United States and has managed citywide and corridor-level pedestrian safety assessments. His 25 years of experience include design of pedestrian facilities ranging from intersection enhancements to major pedestrian bridges. Mr. Parisi is managing the focused deployment of Street Smarts for Marin County's 11 cities and towns. Please welcome Ms. Byrne and Mr. Parisi. I want to let you know that we'll be taking questions at the end of their presentation. And so, Linda and David, please take it from here.
Okay, thanks. Well, good morning to those of you who are on local time here in California, and good afternoon to everybody else. Street Smarts is a traffic safety education program for schools and neighborhoods that focuses on pedestrian, bicycle, and driver behavior. The program was developed by the City of San Jose Department of Transportation and launched in 2002. And this map shows San Jose's location in the San Francisco Bay Area. We're located in the South Bay with a population of 1,007,000 with over 2,000 schools and 19 school districts. Next. Okay. Here are some of the program's educational messages and graphics which show how the materials can be rebranded for use by other communities. All of our materials are in 3 languages in San Jose: English, Spanish, and Vietnamese, and a few other languages have been added in some of our partner communities. These bullet points explain how the program is used in San Jose. Education is used as the first approach before any engineering is considered to raise awareness of residents of their own behavior issues. Most of the police departments that we've worked with in our own city and in our partner cities as well say that up to about 70% of the citations they write when they go into a neighborhood at the request of that neighborhood to do enforcement, those citations mostly are written to the residents who live there. So it's real important to raise the awareness of those residents before making any engineering studies or incorporating any engineering into the neighborhood. This raising the awareness makes any engineering efforts more likely to succeed. The next slide shows the targeted behaviors listed. The top 3 that you see here: red light running, stop sign violations, and speeding. Those are our top causes of accidents in San Jose. The bottom 2, school zone violations and crosswalk violations, are 2 of our most vulnerable populations: our school children and our pedestrians. On the next slide, you'll see a list here of the various programs and activities that we offer to elementary and middle schools. Our instructor teaches behaviors such as making eye contact with drivers, teaches the looking directions for kids, the proper way to cross a street safely, and the proper way to wear a helmet. And one of our key strategies through this program is to deputize the kids at the end of the program to go home and share the street smart safety rules with their family and friends. Our materials, as Christine mentioned, partnerships are really a key to this kind of a grassroots program. And our DVD, for example, that we recently finished was initiated actually by our police department. And that is also, it's either an introduction to our school program when our instructor goes there, or it's a nice leave behind to reinforce the messages of the school program after our instructor has visited that school. And then we have activity books, for example, that drive kids to the website to be able to get the answers that are to the puzzles and activities in the activity workbook. And our website, www.getstreetsmarts.org, has a whole section for children in terms of helping to leverage the messages of the program. On the next slide, these are some of the activities and programs that we offer for neighborhoods. We have a fun and interactive presentation, and we require a commitment from a volunteer for each neighborhood. And once we get that commitment, each neighborhood receives a kit with family activities, DVDs, and lawn signs like the one pictured here. Here are some of our program results in San Jose. And regarding bike helmets, we developed a really good partnership with our parking officers, and they have helmets in their vehicles so that when they see children riding without a helmet, they actually ask if the child has a few moments to have their helmet, have a helmet fitted, and they fit the helmet and teach the child the proper way to wear it, and they give away the helmet at that time. We've also developed a relationship with a local bike club and local bike patrol officers to assist with some of our larger events like our bike rodeos and our helmet events. Here on the next slide, we take the program also to senior centers, service clubs, and other community organizations in addition to neighborhoods. And in each presentation, we emphasize the need for taking personal responsibility for your own safety, whether driving, walking, or biking. We really feel that that's key because sometimes people get focused on what is the law, and if I'm right according to the law, then the car was wrong. But it's really in a large metropolitan area, it's not so much about who's right and who's wrong, but who's safe and who's not. So we really try to focus on that personal responsibility aspect to the program. The next 5 slides show quantitative results for various performance measures that we have related to the program, and I want to note that all of these measure the combined effectiveness of education, engineering, and enforcement. It's very challenging to just take one of those components and measure it individually because we're consistently doing all 3 throughout the city. And so from a quantitative perspective, we really feel that the best approach is to measure the combined results. And here on this slide, as you see, all of our numbers are trending downward. This one shows the number of crashes involving red light running violations from 2003 to 2009, and you'll see those dropping from 960 in 2003 to 627 in 2009. And here we have the number of pedestrian and bike-related injuries and fatalities per 1,000 population going from 0.62 in 04 and 05 to 0.59 in 2008-2009. And this next slide shows the decrease in the injury and fatality crash rate per 1,000 population going from 3.54 in 2004 to 2.61 in 2009. And of the number of bike and pedestrian injury crashes for children ages 5 to 14, which is the specific age group that we target with our school program, doing elementary and middle schools, that went from 105 in 2004-2005 down to 74 in 2008-2009. And because drivers don't change behavior as they cross city boundaries, Street Smarts was designed to be regional in its approach. And so the program is flexible and therefore can be used in any size community regardless of the demographics. For example, San Jose is over 1 million people, and we have the largest Vietnamese population, for example, outside of Vietnam. And Danville, which is one of our partner cities, one of our 25 partner cities, has a population of about 30,000. Partner cities, just a note here, have access to any materials that we currently have for use in the program or ever will have. And in this way, we can best leverage the public dollars. The program cost about $250,000 to develop and market test. So now I'll go ahead and turn this over to Dave Parisi of Parisi & Associates, who will explain how Street Smarts is being used in Marin County. Dave?
Thanks, Linda. My name is David Parisi, and I'm helping the Transportation Authority of Marin implement the Street Smarts program throughout Marin County. Marin County is much different than San Jose. As you can see, we're north of San Jose, actually just north of San Francisco. Much smaller population, only 250,000 people. And that population is spread across the county as well as 11 small cities and towns. Marin is also home to a very successful Safe Routes school program that we use to leverage the Street Smarts work. And as Linda said, the Street Smarts program, which was developed in San Jose, is very successful. So we decided in Marin to use what San Jose has already developed and rebrand it, and develop some additional messages, and also use the tools that Linda has already developed for our use here in Marin. Again, Street Smarts is a public education campaign focused on driver, bicyclist, and pedestrian behavior, focusing also on making streets safer and reducing the number of traffic collisions. And you saw evidence of that in Linda's presentation. In Marin, what we decided to do was to pilot test the program initially in 3 cities, those with the asterisks shown here. And we did that the first year and then expanded it into 8 cities last year. Working with the small cities and towns, we developed the Street Smarts Committee, which consisted of city management, people from law enforcement, as well as representatives from the Public Works Department of each of the small cities and towns to work with us so we could customize the materials, but at the same time make them applicable throughout the entire county. One of our first tasks with that committee was to ask them what are the worst 5 bad behaviors in your city. And it was amazing, or actually maybe not so much, but it was interesting that all 8 communities came back with the same top 5 bad behaviors appropriate to their cities in Marin. Those were speeding, vehicle stopping violations, that is not stopping at all at stop signs or traffic signals, right-of-way violations such as not yielding the right-of-way to a pedestrian in a crosswalk, distracted driving, and then one that was very unique for Marin is bicyclist violation of safety. We have a lot of bicyclists in Marin. Many of them abide by the laws and some don't. So that was something that the community wanted to target as well. After identifying the top 5 bad behaviors throughout the entire county, each city and town was asked to then pick the hotspots in their community where those specific bad behaviors occur and map those out. And that was done internally at each city and town by looking at crash records, complaints, and also just from the law enforcement understanding where some of those bad behaviors occur. And I'm just going to go through each map that shows these bad behaviors from north to south, and you can see that we see different behaviors on different streets. You can see these are all color-coded, which was very helpful for understanding where to deploy specific messages, which I'll talk to momentarily. Some cities and towns had more issues than others. Some cities and towns had different issues than other locations. Very helpful exercise, and it took a few weeks for each city and town to do this exercise. It was very, very helpful. So the program elements in Marin that are used in the 8 cities and towns so far, and we are planning to expand this into 3 additional cities and towns. The elements consist of banners and signs, brochures, community outreach, neighborhood kits similar to what Linda uses in San Jose, a website, and also as much press coverage as we can get. The banners and signs were rebranded from San Jose's stock, and at the same time we needed to do some special things with these as far as the sizes, and that was after you note the hotspots and where you want to deploy things, what infrastructure do you have in place, for instance, to hang vertical banners? How big should they be? What does the wind loading on a pole allow? How about a banner across the street? Sizes such as those. So these are things that we would customize with the kit that we obtained from San Jose. And here's some of the signs being deployed, and you can see each city had at the entrance to its own city a support sign or a banner that was deployed. Here's a series of 2 or 3 vertical banners as drivers are entering a town. Here's a banner at a school, at a middle school, where there are some crosswalk issues, and we wanted to remind people to use a crosswalk at this location. Stopping is part of driving, and again, there was a lot of different messages, and each of these were specifically deployed at locations where there are issues associated with those. So at there's a nearby intersection here, signalized intersection, where there was some red light violation. A school crosswalk, where there are often complaints about drivers not yielding the right-of-way. And then yard signs that were used a lot of different ways. Some ways are creative, to be honest with you, but deployed at citizens' request along streets. Here are some additional banners, a series, which worked out very well when you could march a series of 2 or 3 in a row, different messages. I think you're getting the point here. These banners and signs, we don't deploy them all year long, but instead for about 6 weeks, just before school starts in September through about mid-October, take them down and then redeploy them in the late spring, early summer, just before school is going to let out and then for the first few weeks of summer. We don't want the messages to become stale, but instead to be a friendly reminder over time that this will start influencing people's behavior. Something that's very helpful in our case was to develop what we called message placement plans for each city, and this is one of those. An example that shows the message sign number, where its location is, the quantity, the size, and what the message would be. And these were used to help really deploy the signs to the right location after doing field work and understanding what infrastructure exists to accommodate the signs, and also just really to help out the public works staff. These were deployed and then taken down. So that's signs and banners. We are also working with brochures, again, from stock from San Jose with some modifications for our use, specifically in Marin. This is actually a four-fold brochure. This is one side of it. And you can see it's really addressed at drivers, and they're, so they would pay attention for children in the street. You can see that there's little kids on this brochure. And here's the other side of it, with some tips about safe driving practices, and dangerous driving practices, and stopping sight distance it takes to stop a car. And we actually created brochures in different formats as well, and here's really the same messages, but in this case, this was aimed at high school drivers. You can see that the images used here are high school students or older kids, similar messages, but again, catered to this group instead. We are also doing community outreach, and one of the tasks we completed last year was the development of a compact disc that has 50 or 60 slides in it that can be used for community outreach at neighborhood events, at city events. It's downloadable on the internet, on the web from streetsmartsmarin.org, and it has a slideshow that anybody can give and read and go through easily. The slides I'm going to show you now are from that, and these are all actually focused on pedestrians. And again, the Street Smarts program isn't focused just on the pedestrians, it's also bicyclists and driver behavior, but today's presentation is focused on pedestrians, so that's why these slides are shown here. These slides, there's sets of three, and what they do is we have a did you know question. So in this case, pedestrians are almost twice as likely to die if they are struck by a vehicle at 40 miles an hour than at 30 miles an hour. And then proof to show there's some statistics here. For instance, in this case, there's a slide that shows at 40 miles an hour, there's an 85% chance of death. At 20 miles an hour, just a 5% chance of death. And then followed up with that, the third slide of each set would be one of the messages in the Street Smarts campaign. So for instance, another example, did you know the most common cause of death for children? And you can have a discussion with folks when you're giving these presentations. You can ask questions and pause at this point to really get feedback from people. And then state that, in this case, motor vehicle crashes are the leading cause of death among children 3 and older. And in this case, you can see a photograph we took in here. This is a photo from Marin County at one of our famous crosswalks. And we try to customize this as much as possible. And of course, then following up with one of the key messages from the Marin Street Smarts program, children crossing, please slow down. So another case, after braking at 40 miles an hour, how far does it take for a car to come to a stop? You have that discussion, and you can provide the proof, and then again a message of stopping is part of driving. And finally, one last one. Again, there are tons of messages. We wanted to make this so that people can be a self-guided presentation, can continuously run on a computer. Anybody can give the presentation. So are motorists required to yield to pedestrians who are crossing the street where there is no crosswalk? In California, yes, they are, even if the crosswalk is not painted. So this is a message that we wanted to really give the folks. So let pedestrians cross, then take your turn. Oh, there's one more here. Drivers behave differently. Did you know drivers behave differently when you cross at a painted crosswalk? They're 40% more likely to yield to pedestrians crossing in crosswalks that are painted. So it's called a crosswalk, not a cross wherever. This is a special message we actually developed for Marin for some of the to remind kids that this was again targeted toward kids to use the crosswalks, the painted crosswalks. Then I mentioned neighborhood kits. The neighborhood kits that we are deploying in Marin are available to neighborhood groups upon request. They do include information about the overall program, provide an assortment of lawn signs for deployment, the CD that has the slides, and many, many more that I just showed, educational brochures such as those I showed you, plus more, and then a lot of flyers from AAA and local bike coalition on bike and pedestrian safety. We too have a website. It's called streetsmartsmarin.org. It is hosted by the provider of the program, which is the Transportation Authority of Marin. And it provides information about the program. You can take a survey there as well. Speaking of surveys, it's very necessary for our program to understand how successful the program is. We're in the infancy here, whereas Linda's program's been around for a number of years. You can see the success on the San Jose program. But we know that there's usually about 6 stages for changing behavior: becoming aware of the message, then understanding the message, believing in the message, recognizing the benefit of change, then changing attitude and changing behavior. A lot of these, of course, overlap. But generally, studies have shown that it takes about 3 years to get to step 6. So we're in we're starting actually the end of our 2nd year here, the Street Smarts Marin program. So we're starting to see some changes. We recently conducted a survey. It was online, and we wanted to understand how well the program's working, what messages work, which don't, how much the program has been, how visible it is. And so we did conduct a survey, and the results were pretty impressive for us. We were very happy to see that between 61 and 89% of the respondents think attitudes and behaviors in our community are a problem. That up to 91% think that a focused education campaign can encourage positive change. The messages, which were tested, and Linda talked about that earlier, and with focus groups, that they are effective. The campaign is effective, and most of our communities, all of the communities actually want to continue the program, and those individual respondents, the hundreds that did respond, also want to see the program return. We did have that committee that I talked about earlier to help guide the program. The police certainly saw behavioral changes, and there's been positive impact on attitude. We are going to continue the program this next year. We hope to expand it as we find additional funding as well. So that actually concludes this presentation. So with this, I'm going to hand it back to Jeremy, and be happy to take any questions.
Well, okay, great. Thank you, David, and thank you, Linda. We do have some time for questions, and please enter your questions into the box on your screen. And if we run out of time for your question, we'll attempt to answer it and get back to you after the program. I'm going to, we've been getting some great questions all along. I'm going to start with a question that we got for the WalkSafe program in Miami. This was asked by Anna. She'd like to know, has the WalkSafe program encountered any schools that do not allow their students to walk to school at all? And if so, how do you kind of overcome that attitude?
Well, we haven't actually encountered any schools that don't allow walking to or from school. And that might be a function of the fact that many schools in Miami are located in low income and areas of low socioeconomic status. And so out of necessity, some of these students walk to and from school. They have no other mode of transportation. And so we haven't encountered that, but we have encountered some charter schools that insist that none of their kids walk to or from school because of a lack of proximity. They are either bused in or they drive in because they live too far from school. And so the way we normally respond to that is that whether or not your kids walk to or from school, they're likely to walk somewhere. And so everyone is a pedestrian at some time, and so they need the, they should receive these pedestrian safety and health skills. Regarding our efforts to encourage walking to and from school, we haven't encountered that much of that in Miami-Dade County, where they forbid their students to walk. So I hope that helped a little bit.
Yeah, thank you. Now, this question was asked to Miami-Dade and WalkSafe, but I think it would be good for for both sides to talk about it. The question comes from Samantha. She'd like to know what mechanisms, data systems, or software does Miami-Dade use to accurately track bike ped crashes and incidents, and do you get the data in a timely enough way to adjust your efforts accordingly? I think this would be a good question maybe to start with Miami and then hear what David and Linda have to say.
Okay, so here we've been really fortunate because we're a level 1 trauma center. So we get quarterly trauma registry data. We collect our own prospective data. So we go downstairs to the trauma center every other day, and I get a list every morning because I also run the pediatric brain and spinal cord injury program. So most of these kids end up on our service. So we've been lucky in a way that we're actually the neurosurgery providers at this hospital and at Miami Children's. So the prospective data we collect ourselves. The OCA data we get every, I think, third month from the hospital association. So that's ER, death, and discharge data and hospitalizations. And then the crash data is the one that takes us a year to get, and we're working now with our local folks to see if we can get it more timely where we don't have to wait like 9 to 12 months to get the next year's data. So, and then as well as the GIS mapping, we're very lucky as well to have somebody here that gets us all our zip code data from within our teams. So, you know, it's taken us 8 to 9 years to get access to all this good data, but it's important so you're able to really look at the program and track and monitor change.
And in Marin, you know, we're working with many small cities and towns and their police departments very closely, so they've been able to provide that data for us very specifically related to pedestrians and bicycles. Linda, you probably can offer.
Yeah, in San Jose, I'm also the public information officer for the transportation department here, so I receive press releases instantly from our police department for any fatalities. And of course, our engineers go out to the scene of any accidents and review that in terms of looking for any safety improvements or anything that could be done to enhance that situation going forward. And we also get the crash data entered into a custom database that we have here, and that data enters, I don't know if it's the same nationwide, but out here our police departments and California Highway Patrol use a report called the 555 form, and it's just basically the police accident report. And so everything from each of those blocks on the accident report gets entered into the database, so we're able to sort and provide reports for pretty much any one of those entries on the database. And of course, sometimes we're challenged with the cause of the accident because sometimes there's more than one cause contributing to the accident, and then it's a little bit of a judgment call as to whether it was more of a red light running or a distracted driving or speeding, because maybe the driver was doing all three of those. So there's a little bit of ambiguity about that, but we do know on going to the report exactly what was cited by the police.
Okay, thank you, everyone. Kind of sticking with another data question. This one comes from Hank, and he asks, "Do you have?" I'm going to direct this initially to the Miami folks with WalkSafe. Do you have outcome comparisons to other communities not using the program? And he states the U.S. numbers of child ped injury in general have been going down considerably in the past 6 years, perhaps due to increasing use of autos or less walking by kids. In other words, how solid is the evidence this really works to prevent pedestrian injury?
Okay, so that's a good question, and we've been now looking at trends in other similar communities, like sort of we're trying to match to what we see here in Miami-Dade. But the evidence really for this program is from the work that we've done over the last, I'd say, 6-7 years, where we've measured the educational component of this program, pre-post, 3 months, 8 months. We've published this data, and also the behavioral data of looking at, are they using these safety education programs that we're implementing in these schools as they come to a curb and cross the street. And so basically the evidence in this program is looking at our educational component and are they actually implementing these educational skills that they learn when they come to a curb. So it's educational and behavioral. And also, pardon, Chris just wants to add something too.
Also to add to that, although there are decreasing trends all over the United States, we have noticed that our decline in injuries and fatalities has actually been steeper than those of the overall United States and other areas. And we also compare our county to other similar counties in Florida, and our rates are decreasing quicker than other neighboring areas. So that don't have the program.
Okay, thank you for that. A lot of people are interested in how both WalkSafe and Street Smarts are getting their funding. I know there's Safe Routes to Schools funding. Are there some other sources that you're tapping into? We'll start with Street Smarts, please.
Well, with San Jose, the program is funded through the city's capital budget, and from time to time we apply for grants to support the program. For example, our school component was started with a grant for about $250,000 from our California Office of Traffic Safety, and we just applied for another grant that's in the process of being evaluated at this time, also through the California Office of Traffic Safety for taking the program to an area that we have that's quite an impoverished area of town where they're starting a special program of consolidating community resources. And so we're hoping to get funding to provide helmets for all of the kids that need them in that school district, for example, as well as to cover some of our a small percent of our staff time. So at this point, we're primarily funded by the city's capital program.
Marin's program is actually funded by two sources, by the Transportation Authority of Marin, which administers a half-cent transportation sales tax for the county. And there was a grant that was received actually the federal government for the non-motorized transportation pilot program. Those two funding sources have kept Street Smarts alive for a couple of years. However, where we're going next is we want to keep this program sustainable, and we're going to be looking for partners, such as maybe insurance companies, college, other types of partners, banks and whatnot, to pick up particular elements of the program, maybe brochures, maybe the web work, some of the banners, and they'll get their logos by doing that. Some of the partner cities that Linda alluded to earlier have done just that, where there may be a team program element that was picked up by a private sponsor. So we're going to try to do that. It's going to be tough in this economic climate, but we want to make the program sustainable.
And from the Miami side, it's very challenging, but again, being from a trauma center and having more of the medical aspect of looking at crash and fatality and head injuries, we're able to get some money from our University of Miami trauma systems. Also, our emergency medical services for the state of Florida is funding our statewide Safe Routes to School, the local Miami-Dade program, Department of Health, the Miami Project to Cure Paralysis. We had a Back Your Block win with Nike, a Children's Trust. So, we've been able to be, diverse in our funding depending on the project that we're doing. National partners are always good, so we're now talking to some big national corporations to see about taking this out of the state for us, and then always trying to stay on the side of science to write some of these grants that may even be more CDC, sort of NIH. So, you have to be diverse and you have to be creative.
Oh, that's a good point. One more question about funding. Actually, this is a more specific one. It comes from Samantha. It's also about networking with your, some of your partners in your region. How do you get the police, this is directed towards Street Smarts, and Linda was speaking about this, how do you get the police to distribute bicycle helmets to kids? And, and also how do you get grant funding for, or what's your funding source for that program?
Okay, actually, when I said our parking officers, those are not sworn police officers. Those are officers with the Department of Transportation, which is the same department that I'm in, and so those are really close working partnership with those folks. So they're the ones that go around and, especially in school zones, and our focus here is not so much on writing citations, but more on education with the parking officers. And so they take our Street Smarts brochures, particularly the ones focused on our school zone safety brochure, and they will give those to parents that are waiting at schools for pickup and drop-off times. And in fact, if they're parked in an area that they shouldn't be parked or something, they will say, you have a choice. You can get a citation, or you can move your car and then read this brochure while you're waiting. So it's pretty effective reinforcement tool for the educational material. So they're the ones that actually give out the helmets. But just a quick note on, it's really important with any of these programs to get the police department involved. And we did that from the very get-go by having them be part of the foundation development team for the program, and that got them buy-in, and it really helped to have a very savvy police chief who saw the potential of having a program that could provide some very good public relations for the police department. And so when you have that kind of a connection, it's pretty easy. Like if we're doing a bike rodeo and it's a very large event, we will invite the bicycle patrol officers from the police department to participate. This is actually, it's not only doing us a favor, but it's doing them a favor, because it gives them an opportunity, particularly with the older kids, like, say, middle school, to interrelate with the children in a very positive way. And that's something that we try to stress by getting the police involved, is the what's in it for them. And so where we can educate them about the what's in it for them component, it's been pretty easy, actually, to get them to be supportive of the program. And in the other communities that I've worked with, the other police departments as well have been very supportive. And so I think just kind of demonstrating that connection between education and enforcement and how the two can support each other is a real important key in getting the participation of the police department.
Just another point from Miami. We just started a bike safe program. We're using the WalkSafe model, and we're just in the infancy stage of piloting this. But the Epilepsy Foundation actually provides us all with our helmets when we do our outreach events, because we're really big, since this is a head injury center. We're really big at helmet fitting and, protecting the brain. So the Epilepsy Foundation gives us all our helmets for free.
Wow.
Oh, that's interesting. Actually, that was another question that we had for WalkSafe. Someone was curious if you also had a bicycle component, and maybe you could speak a little bit about BikeSafe and how closely it resembles WalkSafe.
Yeah, we got another grant, and it was from the MPO, and because of the success with WalkSafe, of course, the next thing's bike. And so what we did was same thing when we did WalkSafe starting in 2001, 2002. We took about 6 months to review all the evidence of the best bike safety programs in the world. And we actually came up with some really good programs in Oregon, here in Florida. I think there's something that we looked at from the Maryland group, and we decided that for our needs here, we combined a few, and basically it's the Oregon program, where we just finished a pilot in a park. So we're going to be doing some after-school programs in parks with middle-aged school kids. And we just finished our pilot, and this is how we did the WalkSafe. We started with a pilot. We did a very small, focused study. And then what we're going to do is tweak this, and we're going to now go to Parks and Rec, partner with them, and now do some summer programs in some of these parks. So stay tuned, but I think that the model is going to be developed the same way as we did the walk program. But with the helmets, I think you have to sort of reach out to some of your community partners, see who's already doing this, because we also have Injury-Free Coalition here, which is a whole other big group that does a lot of injury prevention programs, as does Safe Kids, and they already were in the works doing this before we started the bike program. And we went to our first meeting, and there they were, epilepsy, telling us, you ever need helmets, we have them all. So you just have to reach out to things in your community before you really get going to see what resources there are.
Yeah. Speaking of, we'll just stick with the bicycle topic for one more question here, and this is directed toward David. He was speaking about bicyclist violations, and Maggie asked if David, if you could classify the bicyclist violations that were identified the way you classified other driver behaviors.
Well, I think the classification has to do with what we see in Marin, bicyclists violating stop signs, violating traffic lights. Also, there's a lot of bicyclists that train and ride in packs, 7 or 8 or 10 people, and maybe ride 2 or 3 abreast, taking more than the bike lane, and actually that aggravates a lot of drivers. And so those are some of the behaviors we're trying to address on the bicycling side. At the same time, we want to promote sharing the road, so it isn't just aimed at negative bicycle behavior, but to really remind drivers that it is a shared environment, and so that the same road, same rules type of campaign is also one we're administering.
Okay, thank you. I have one more question for Street Smarts here. And Carolyn would like to know, do you have a Street Smarts program for areas of high concentrations of older adults, like senior zones? And if so, how is it geared towards communities that have year-long issues versus just certain times of the year?
Linda's probably best at answering that one. We don't see that here in Marin.
Yeah, in San Jose, what we do is we reach out to all seniors throughout the city, and we have a large number of senior centers, I want to say like 20 or 25 throughout the city that provide really critical senior services, such as the free lunch program and other things like that. And so these are real community resources for seniors, and it gives us a really good opportunity to go there and to reach these seniors with a program that's particularly tailored towards seniors. And we have different focus. So sometimes maybe we're talking more about senior drivers and what some of the resources are for senior drivers and what are some of the issues. Another time we may be talking about pedestrian issues and how to cross the street safely and why that's important. And we learned it when we were very young, but it's good information for us to keep in mind. We don't have, I would say, a lot of seniors that ride bicycles here, but we work with each individual senior center, and they know the demographics of their audience pretty well. And sometimes we'll take a survey before we go out to the senior center to find out what some of the issues are. So that's the way that we reach most of the seniors here in San Jose. There's a few other senior groups that meet at some of our community centers, and we're invited from time to time to and also do active outreach to those to go out and reach those seniors as well.
And I just want to clarify something real quick. In Marin, we don't have any messages that target seniors, but we mean to target all different age groups and different modes. But it is interesting, in our surveys that we conducted, we had a lot of responses. The majority of the responses were from seniors, so that was interesting to us.
Okay, just a couple of really quick questions. We're just about out of time here. This is just looking for where we can find some more resources. I have a question for Street Smarts of where we can get a hold of some of the materials for the high school students, specifically the posters. Maybe you can tell us if they're available online.
We actually, excuse me, we don't target high school students simply because we don't have the resources. We have put in a grant last year for starting an offshoot program that specifically targeted high school students. It's, as everybody knows, a pretty tough audience, and you really want to have a good solid program when you go into the high schools, and we just don't feel at this time that we have the resources to do that. And while the grant was rated very highly throughout the process because of the federal transportation appropriation being held off for another year, the state granting agency did not want to fund any two-year programs last year, and of course this year they're in the same boat, and so we will go ahead and reapply for that in the following year. But in terms of accessing the materials, if anybody is interested in the program, we don't give out the materials individually. They're all available on our website, www.getstreetsmarts.org, and people are certainly able to download those, and we would hope that people would just do that on a small number basis, and if it's something that your community is interested in having on a community-wide basis or even a school-wide basis, to contact me. And the program at this point is about $3,700 to have all of the materials that we have currently created and all of the materials we ever will create rebranded with your city name on it. And so that basically means you get all of the electronic files for all of the messages, including all the messages that Dave showed, which some of them are different than ours, and various other partners as well. And this represents, as I mentioned in my presentation, about a $250,000 worth of public dollars that were invested in this program for market testing and development. So anyone that's interested can either go to the website and do a contact me or contact me. I'm not sure if our presenters' contact information is available somewhere, but I'll be glad to talk to you about it. But we don't do individual brochures or just lawn signs or something, because we really believe in keeping the integrity of the program as a program. You're not really going to change behavior with a sign, and you're not going to really raise a whole lot of awareness with just a sign. It really needs to be more than that. And so in order to keep that integrity of the program so that it continues to work and have some positive impact in every community, we really just want to work with people that are interested in adopting that program.
And one other note, one of the Street Smarts partners, which is San Ramon Valley, East Bay area, has launched a campaign called It Happens. So the It Happens campaign is focused on teenagers, and it's a web-based program where kids make videos recounting real-life stories of, near misses and things like that, and they put their videos on YouTube, and it's been very effective. I haven't followed it too closely, but we can provide more information about it, and there's some information on the web about it as well.
Yeah. Okay. Thank you, David. And I'll be posting these links that you've shared with us on our on the archive page of today's webinar at walkinginfo.org/webinars. So our audience should be able to locate those if they have any questions as well. And just real quickly, Dr. Hotz, what's the website for BikeSafe?
Oh, we don't have one yet. We're just working on it now. But for WalkSafe, if there's anything, it's the www.walksafe.us. And we're also going to be opening up a WalkSafe store, that if people want to order rulers or pencils or brochures or posters, we're going to be having those available within the next 2 weeks.
Okay. Thanks for letting us know about that. And fortunately, that's all the time we have for discussion. And I want to give a hearty thanks to our presenters, Dr. Jillian Hotz and Christine Stinson of WalkSafe in Miami, and Linda Crable-Byrne and David Parisi of Street Smarts in California. I really enjoyed your presentations, and yeah, you handled the questions really well. Now, if we didn't get to your question today, please do not hesitate to contact me at webinars@hsrc.unc.edu, or give me a call at 919-843-4859, and we'll try to address your question. And before we end, on this last slide, I put up some resources. On the education section of the PBIC website, walkinginfo.org/education, we provide some important resources and messages for a range of different audiences that can be part of an educational campaign or program, such as WalkSafe and Street Smarts. You can also take a look at our selection of case studies at walkinginfo.org/case_studies, which includes success stories of pedestrian educations from across the country. And I also mentioned earlier, you can take a look at the new PBIC video library and find lots of educational videos there, such as Willie Whistle. I want to remind you that you'll be able to access a recording and transcript of today's program, as well as view a PDF copy of the slide presentation. And again, that website is walkinginfo.org/webinars. And on this page, you will also be able to register for the next Livable Communities webinar coming up on Thursday, April 15th from 2 to 3:30 p.m. Eastern Time, when Bruce Friedman and Scott Wainwright of the Federal Highway Administration will talk about what's new for traffic control devices for pedestrians and bicyclists in the updated 2009 manual on uniform traffic control devices. And finally, I just want to remind everyone that a very brief survey will appear once the webinar is ended. And again, we very much appreciate you taking a moment to complete it. Thanks again to our speakers, and thanks to all of you for attending today's PBIC Livable Communities webinar. And have a great afternoon.
Thank you.
Thank you.